Section 7. Diagnosing typhus. Laboratory tests for confirmation. Diagnosing typhus fever typically involves a combination of clinical evaluation and laboratory testing. Doctors consider the patient's symptoms, medical history, and potential exposure to vectors. They then order specific tests to confirm the diagnosis. Asterisk blood tests. Serological tests, such as the Weil-Felix test and ELISA, detect antibodies produced by the body in response to typhus infection. These tests are helpful in confirming the diagnosis. Polymerase chain reaction, or PCR. PCR is a highly sensitive and specific test that can detect the DNA of the bacteria causing typhus in blood or tissue samples. This test is particularly useful in the early stages of the disease. Asterisk skin biopsy. In some cases, a skin biopsy of the rash may be taken and examined under a microscope to look for characteristic changes associated with typhus infection. Section 8. The perils of untreated typhus. Complications and risks. If left untreated, typhus fever can lead to serious complications. These complications can affect various organ systems. They range in severity from mild to life-threatening. The central nervous system can be impacted, with typhus potentially leading to encephalitis, which is inflammation of the brain, meningitis, the inflammation of the membrane surrounding the brain and spinal cord, and even seizures. The respiratory system is also at risk. Pneumonia, a serious lung infection, can develop as a complication of typhus, leading to difficulty breathing and respiratory distress. In the cardiovascular system, typhus can cause myocarditis, which is inflammation of the heart muscle, and pericarditis, inflammation of the sac surrounding the heart. These conditions can impair heart function and lead to heart failure. And let's not forget the kidneys. Kidney failure is a rare but serious complication of typhus. It occurs when the kidneys are unable to filter waste products from the blood effectively.